Okie dokie. Right. Okay. So I'll just kick things off then. So my name's Simon Wills. I work at the MPA, and I'm pleased to be joined tonight by Jeremy, Shins, Gareth, and Derek, who will be running through the presentation Earn Additional Income with CityDoc's Travel Services. Just really briefly, just to cover kind of the technicalities of how we're going to run tonight. So we'd encourage you to send your questions in throughout the presentations with the Q&A function, which you'll find at the bottom of your screen. Just click on there and you can pop in any questions you so wish. There'll be dedicated time at the end of the presentations to go through all the questions. If you have any problems at all, send in a message via the Q&A as well, and I can help. So if there are problems with your audio or visual, we can help with that. You won't be able to raise your hands during this event, but as I say, we do encourage you to use Q&A. The event is being recorded, so should you miss any of it, we will be putting it on demand from tomorrow. But without further ado, I'll hand over to Jeremy to kick things off.
Many thanks, Simon. I appreciate that. Hello, everybody. Thank you very much for joining this evening. We have a presentation to go through that I believe Shins will be sharing with us shortly. But I just wanted to introduce myself. I am Jeremy Garman. I'm the Managing Director of CityDoc and have been for the last 18 months now. And with me are my three erstwhile colleagues. We have Professor Dr. Derek Evans, who is our clinical lead and pharmacist consultant who works very closely with us at CityDoc and the team. We have Shazan Akhtar, known to Shins by his friends, so we all call him Shazam, who's here as our new pharmacy account manager, and he'll be doing most of the talking, you'll be pleased to know this evening. And we also have Gareth Neal, who's our head of customer services here at CityDoc, who works very closely both with our customers and patients, but also with our pharmacists and pharmacies that are currently with us. So Shins, are you able to share the presentation?
Yeah, sure. I'll just get the screen up.
And so, as Simon said, hopefully what we say today or this evening will be of some interest to you on the webinar. If you have any questions, please do pop them in the Q&A. Gareth will be looking through them kind of live, and we'll either answer some directly in that chat function, and some we'll keep to the end, and then we can have a bit more of a discussion live and bring in Derek if there are any more clinical queries as well. But really what we wanted to do this evening was really talk around how the fact that CityDoc have partnered with the MPA in order to provide its members with other and further channels to make money in your pharmacies and use that specifically with regards to travel vaccinations. Because I'm not sure whether some of you will know CityDoc, Shins, if we can hit the next one, but effectively, who are CityDoc? CityDoc, we've been around for just over 16 years now. CityDoc was initially founded by three doctors, a husband and wife, and one of their friends, back in 2006. We have one of those doctors, Dr. Owen McSweeney, is still with us as a founder, shareholder, and chairman of CityDoc. The business was sold in 2019 to a Danish vaccination company called European Life Care Group. So they are a very large provider of vaccination services throughout Europe and Scandinavia. And they vaccinated, as it says there, about 5 million people since 1998. So we are, as part of that group, one of the largest provider of vaccinations to both public and private sector throughout Europe. CityDoc was based in London for many years, but last year we moved in with our sister company in our new headquarters in Hertfordshire. Our sister company, which looks after the UK public sector, is called Vaccination UK. And actually they provide and work with the NHS. They provide the flu and HPV vaccines on behalf of the NHS for a lot of the school immunisations programmes. A lot of I think they have 10 or 11 London boroughs, plus Hertfordshire, Herefordshire, Warwickshire, are moving into East Anglia. So we work very closely with them as in partnership. So they provide the public sector, and CityDoc look after the private sector elements of within in the UK for the ELCG group. We have many years of travel care industry experience, and we work very closely with our current pharmacy partners in providing clinical governance and marketing services. So kind of what do we do? We as CityDoc operate 11 flagship clinics in London and the South East. These are standalone clinics where we have our own doctors and nurses providing all travel services and travel health advice and medicines in London and down in the South East. This also incorporates the London Travel Clinic brand, which was acquired by the European Life Care Group a few years previously. And the clinics in the South Coast were all independent travel clinics that have been acquired and now operate under the CityDoc sort of umbrella brand. And we also provide a network of in-house clinics with specially trained pharmacists, and we work very closely with pharmacists over the last few years to provide a franchised operation. So we work with pharmacists to provide travel vaccines, general vaccines, in our own clinics, GP services, sexual health screening. We have done a lot of that in our own clinics, and there are a number of pharmacy clinics that also offer sexual health screening as well. Like everybody else in the last few years, we've done a lot of COVID testing and providing COVID tests into the home market as well. And we also work with large corporates, be they travel agencies or just large corporates in themselves, to provide everything from flu vaccines into more specialist programs of vaccinations, including occupational health services where required. We also work, and Derek is very closely involved with looking at the yellow fever and how we support provision of that, and also anti-malarials and other more specialist travel medicine that if you have questions around, then I'm sure Derek will be able to answer that in much greater depth than I can. And we currently provide, pre-pandemic, around 100,000 vaccinations every single year, but we are looking to really increase that growth as we move throughout the rest of 22 and into 23, hence the partnership we have with the MPA. I'll let Shins now take over, because he's going to take you through what we have as very quickly our standard model that we have currently, and then the actual model that we've created specifically for you as MPA partners.
Hi everyone, nice to meet you all. I'm going to flick through quite quickly what our standard model is. So this is not what we're on the call today about, but I just want to talk through what we currently offer our partners at the moment. So we're currently in partnership with 170 pharmacies across the UK. What we do is we provide them with a free booking patient record system, so they can receive and book in patients from our side. We also provide them with a large marketing investment. So we invest up to £2,000 each pharmacy which is onboarded. We provide them a large range of PGDs, which as part of this model, and we also support them from a clinical angle with all the PGDs, PSDs, a clinical support line with Derek if they need it as well. We have a high-performing website which sees over 200,000 patients a month as well. So we see a significant amount of traffic coming into pharmacies. So this model is well suited to a pharmacy which hasn't got a well-built travel health clinic services set up at the moment, and they're looking to launch that service within the pharmacies. This is the model we would explore. On this model, what we do is provide a 55%, 45% profit share split. So essentially what will happen is your pharmacy would take 55% of the profits, and we would take 45% of the profits. Average takings in our pharmacies at the moment are anywhere between £1,500 a month to £4,500 a month per our pharmacies up and down the country. What I'll talk through briefly is what we're here for today, which is our MPA partnership model. It's slightly different. It's geared more towards the pharmacies which have a well-established travel clinic set up at the moment, and they just want incremental traffic coming through. What we do slightly differently is provide every pharmacy with a free booking calendar tool. What they would do is receive and manage those patients through the booking tool into their new existing diary. So essentially what we do is send the patients through, the patient will book online. We'll usher these patients through into a booking calendar tool, which you'll be able to see from your system. And then you can manage that patient into your existing diaries and service them and administer the vaccination. We'll do a large marketing investment into each pharmacy using what we call an effective local marketing tool called Yext. This model is slightly different. We don't provide with the PGD service or PSDs because you're quite established, you have your PGDs in place already. So what we will do is provide you 100% of the profit share. So you will set the price in the pharmacy, we'll just provide the incremental traffic into your pharmacy as well. You charge the price to the patient and you keep all the profit as well. So it's a great scheme to be partnered with on the MPA. You will have support on hand. It won't be clinical. It will be with our CityDoc pharmacy administration team, which is available Monday to Friday, 9 to 5. And that'll be dedicated more towards support with a calendar booking tool and kind of administration questions that you might have as well. Again, a lot of the traffic we'll generate and bring into your pharmacy will be through our website. And we see 200,000 unique visitors every single month through that.
I think before we move on, actually, Shins, if you don't mind just going back, I think one of the key things we did when we started to come up with our partnership models, we spent a long time talking to the team at the MPA and a lot of time obviously gaining feedback from our existing pharmacy partners. And what we felt was because a lot of you will already have either existing travel clinics, existing arrangements for the provision of PGDs and other compliance and clinical support, including patient record systems and diary management systems, was that there was probably a need and certainly a desire for a company such as us to be able to provide actually more business and more lead generation into your existing clinics. And that's really where the MPA model, Shins, I think we're still on the center one there. That's where this really came from. It was a slimmed down model that was very easy to implement within your own existing clinics, that didn't require any burdensome extra compliance or adherence to our diary management systems or patient record systems. It literally allowed you to be able to receive interested high quality sales leads directly into your existing clinics, and for you to be able to actually have, very simply, whatever you charge the client patient on the day is what you keep, rather than any profit sharing or anything like that. And I think there's been a number of other people out in the market who have been quite vocal about this, but the really key method here is patients will be paying the £15 booking fee to us to secure their appointment with you and secure their appointment with a qualified pharmacist who will be able to give them a consultation, and then dependent upon what you prescribe at that point is entirely between you and the patient. So that's really quite key. The patient themselves, yes, they're paying the £15, but that's to secure their appointment because your time is precious and to secure your expertise. So generally appointments are between 15 to 20 minutes for an initial vaccine appointment we see in our own clinics, and actually there is a value attached to that. So I think sometimes when patients say, "Oh, what have I paid my £15 for?" is to secure their appointment and to secure time with a qualified professional to give them the advice that they require. So anyway, Shin, sorry to interrupt you.
No problem. Thanks for explaining that in a little bit more detail, better detail than me as well. What I'll do is walk through the patient journey, what that looks like. So essentially what will happen is the patient, just like Jeremy said as well, will pay a £15 non-refundable booking fee to CityDoc. Again, this reduces the level of DNAs in your diary, so it is what you get in your diary. If we send a patient through, you can see them booked in, they're going to turn up to your diary. So it prevents any lost business, any kind of appointments which you put in one side for a CityDoc patient, they will turn up. The patient's booked into your pharmacy using our calendar booking tool. You manage the patient into your own calendar software. So if you're using Clara, for example, you can manage that patient into a time slot in there. The patient would then arrive through. You would confirm the patient's attendance, also confirm the price of the vaccination to them, carry out the vaccination using your existing PGDs. Then finally, right at the end, you just take the full payment from the patient. Again, the price is set with your pharmacy, so whatever price you set is the payment that you take, and you get to keep all the profit. What I'll do is hand over to Jeremy again, just to take us through Yext.
Thank you, Shins. Yeah, I said Shins would be doing most of the talking, but it appears that it's back to me again. So as Shins already mentioned, we have a very high performing website with a very large amount of search engine optimization, so organic traffic that comes through. One of the innovations that we brought on at the very latter part of last year was this listings platform called Yext. It's a special sort of location management tool, and it allows us to, if you come on board with us, put you not only on our website where you would have your own clinical page, we put you on Yext, and it pushes out your details to 52 listings providers, such as Google My Business and Facebook and all of those. So that's all managed by us on your behalf. Shins, if we can just, I feel like that chap from the those briefings they used to have around COVID saying, next slide, please. But this just shows you the publishers that we've got there. Some, everyone from even Alexa, Nextdoor is now coming up hugely, but there are some quite small ones. But what this does do is it really does push the search engine optimization for the locations around where your clinics are located. And the most popular search term is clinics near, travel vaccinations near me, or travel vaccines in a particular area. And so what we just have here this is, I think someone put travel vaccines in Bromley or Bexley Heath, I think around here. And what happened is it just shows you that it pops up. This is an organic search, so not a paid ad for. It popped it up, and it just goes straight through into a typical clinic page on our website where we have a map and the opening times and so on and so forth. But what this also allows us to do, much greater than sort of page search, and here we've got travel vaccines Berkhamsted. That's just where I live, so I use this on a regular basis where we have one of our CityDoc pharmacies. We push our standard models through pay-per-click, so you can see right at the top there we have an ad for our clinic. However, what it also does is then push through everything on the right-hand side. You can see there that's come through the Yext platform, and that's pushed the pharmacy, the H.H. Dickman pharmacy that we have in Berkhamsted, above the 4 other pharmacies that there are in Berkhamsted, including Boots. It's pushed us right up there into that, what they call that map pack position there. The number one place you want to be. And then also further down there was an organic listing that comes through our website. And on the this is actually the lower part of that first page, so page 1. We also have Yell that's been pushed through Yext, and down the bottom there's Silex, and then there was, I think, a couple more right at the bottom. So we're actually owning quite a lot of real estate on that first page for the most popular searches, either travel vaccines near me, and that's people who are looking near in the locality where you are, or being very specific by saying travel vaccines in location, be that Berkhamsted or Bromley or Bexley Heath. So this is very, very key and an absolutely vital part of how we market your clinic here. So we're able to adjust everything from opening times. We're able to put the what 3 words location elements in there, because if you're in a slightly hard to find area, it gives really, really accurate location data. So there's a huge amount that we can really maximize really marketing your individual clinics.
I'm just going to take you through the booking calendar tool, which we'll provide you with at the MPA. Very short introduction to what we supply you with. So as you come through our onboarding process, this is the tool we'll provide you, so you can see the patients which we booked into your pharmacy. So essentially, when a patient comes through to our CityDoc web page, there will be a tool available for them to book the appointment that will then come through to the screen. It will show you Monday through to Sunday, and also the times your clinic are open throughout the day. What you see is 2 color icons on your screen throughout the whole diary in the week. You have provisional, which is light blue, where the patient's confirmed the booking, and dark blue, which is confirmed, so the patient's been booked in and ready to be seen. The other part of the tool, which is quite beneficial as well, also for us to work with you, is where you list your contact details. So this would be your contact email address, your contact number. This is quite an important area for us, so we can book patients in effectively into your pharmacy. If we haven't got the correct email address or contact number, we can't get the patients booked into you. So you can actually manage this yourself using this booking tool. Really nice and easy, simple to use. In terms of requirements, so again, 100% of the profits are yours for the pharmacy. What we're looking to do is we've got a few asks if you want to come on board with us to onboard. We just ask that every member of your staff, every pharmacist has travel vaccination and mandatory training. The majority of the things you've probably got here already, so your GP, HC registration, your indemnity insurance, your DBS checks. We also want to make sure that you've got your contract set up with your suppliers at the moment and that you maintain an adequate amount of vaccine stock. Our minimum order quantity expectations is anywhere between 5 and 8 of every vaccine in stock. Also, just to maintain all your relevant internal pharmacy policies, safeguarding, etc. And most importantly, and lastly, just please do inform us of any changes to your services in your pharmacy. If a pharmacist leaves, please do come back to us so we can just ensure that you have the relevant training and we can continue in the partnership we have. So I'm just going to really quickly summarize what we've just been through today. So as part of the MPA brief, we'll provide you with incremental traffic into your pharmacy. That can range anywhere from 1.5k to 4.5k a month coming into your pharmacy. We won't provide you with, as part of the service, it won't be the PGDs and PSDs, but we expect that you will have a well-established travel clinic. So that incremental traffic will just be flowing straight through to you using our calendar booking system tool. You can use that to manage the patient into your own diary, take the payment, and you get to keep all the profits from that stage as well. We'll also provide you with Yext, that marketing tool that Jeremy went through earlier as well, so we can market your pharmacy as much as possible and generate as many people coming in and visiting you on the day as well. In terms of next steps, what would be great is Simon's also got this link up to share as well. Please do visit this URL on top if you want to sign up. Alternatively, what you can do is go to Google search, type in CityDoc MPA. That would generate the sign up process to join the CityDoc MPA partnership process. You'll be in contact with me and I'll be reaching out with you over the next week to just help you get onboarded and sign up. Brilliant. I'll pass over to Simon and Jeremy and we'll take from there.
Yeah, thank you, Shins. I don't know what happened there. There was 2 summary slides that never made it, but
yeah, it's I'm not sure. I'm just looking now and I can see it's on the page, so apologies. It's
we will ensure that they're uploaded to the recording that will be available tomorrow. We'll work with Simon on that to make sure that that's there for you. But pretty much it was as Shins had said. I mean, this webinar was really meant as a sort of a quick introduction to who we are, if you didn't know, and also then to for people to be able to ask some questions. I think there are a couple of questions that I can see. We've got one from Vikesh around who do we contact for more onboarding. Again, I think literally as Shin said, the last slide has a link there, but you've got your you've got your phone number there, so we'll be in touch on that phone number, Vikesh. Thank you very much for that. And we've got what of an MPA pharmacist who are not already providing a travel clinic. I think maybe Derek, if I can bring you in from the dark there. I mean, the MPA model that we created was for a very simple way for people, if they already had an established clinic, to join. However, what key things would they need to do, Derek, in order to get themselves in a position to be able to join? One easy answer is you can join our standard model, and there's elements of training and so on and so forth there. But Derek, what would you advise?
Well, I think with travel vaccinations, it is a key thing. But travel health and travel medicine, of course, is much wider than just vaccinations. So apart from having your protocols of your vaccination training, and you're up to date with your anaphylaxis, basic life skills training, and the administration procedures that go along with all of that. So that's your key core competencies that need to be present to do any form of vaccination service. To take travel medicine, you've got to bear in mind that vaccines are only 2% of all the infectious diseases in the world, according to WHO. So World Health
are saying there's 98% of the world around and outside of medical conditions that will require a broader knowledge than just vaccines. And that's what you can do. There are different training courses, and the supply function can come with the PGDs. That's something which we do as a premier service. But rather than just give you some training linked to a PGD, which is the minimum standard for the MHRA, we will also run a medical support process as well. We run it 5.5 days a week, so we're there on Saturday mornings as well for you. I tend to take most of those calls, but I have, when I'm not available, we have a nurse prescriber and a doctor as well to back us up. And we will be there to help and take anybody through the steps. So we've got a support process, we've got an education and training process, and we've got a PGD process. Putting those together, that would help anybody start a travel medicine or a travel health service from people who've come through, who've got experience from operationally, clinically, and from the medical background. Jeremy.
Brilliant. Thank you very much there, Derek. If someone's got any other questions on that, please put them back in the Q&A. I'm sure Derek will be able to answer any further questions. I've just got, there's another question around from Mohammed saying, if we're already partnered with CityDoc, is there an option to proceed with the MPA model? And yes, I mean, please do talk to the team, Gareth and Shins, around being able to transfer from the kind of standard model to the MPA model. Obviously, be cognizant of the fact that you lose access to the PGDs, lose access to Derek. But absolutely, we want to partner with as many pharmacies in the right places as possible. So yeah, please do deal directly with Gareth and Shins on that. Other questions we've got one from a follow up from Vikesh. Does the pharmacy deduct the £15 from the final bill of the patient? The answer to that is absolutely no. I think when it went live on the MPA website, there was a misspelling or an error with the text. So if you'd already read it previously, that's now been corrected, but absolutely not. As I said, I think there are other providers of services out there who have told all their members that if you join with CityDoc, that you'll be giving away that £15. That is not the case. The £15 is a booking fee that comes for us providing the services, the website, the Yext, and also a commission back to the MPA for them to carry on the good work that the MPA do. But that is taken from the patient right at the start of the booking fee. That secures their appointment with you, and that secures their 15 or 20 minutes with a professional who is going to give them a consultation, which will hopefully lead to a vaccination or prescription of other travel health medicines as appropriate. So yeah, no, the £15 is paid up front. You do not refund that. I'm just thinking, okay, great. Oh, you agree. Well, I'm delighted with that, Vikesh. Thank you for that. I'm just trying to think if there are any other questions at the moment. Oh, and I think Gareth is responding on the text to some. But I don't think there are any other questions coming through. So I am hoping that there are some of you out there other than the 4 or 5 people that have sent through some questions. Gareth, do you want to answer that then?
Just a minute. Hi guys, so Felix asked, what of MPA pharmacists who are not already providing travel clinics? So again, this just goes back to if you already have PSDs and PGDs in place. If you don't have the clinical governance in place, then we can look at our standard model. But if you do have or are looking to set up your own travel clinic, we can always communicate with yourself and me and Shins, and we can look to get you set up on the MPA model once you're up and running.
Brilliant. Thank you. Thank you for that, Gareth. I'm just thought, have we got any other questions coming through? Right, I think I have one from Pavan here. Do we source the vaccinations ourselves or do you supply? We can effectively do both. So as part of our standard model, we have agreements set up with a number of suppliers and have access to our account to work with and order vaccines through, be that Sanofi or Valneva or whoever. And in the vast majority of cases, using our account to do that offers you an excellent price. And in the case certainly of Sanofi, the best price that you will get within the UK. However, if you have, through other agreements with suppliers or other buying groups you may be part of, access to the vaccines, then you are absolutely in your own right to go and continue to use your existing suppliers. So if you want to use those, carry on. If you want to discuss coming on board with ourselves, please do come on board and we'd be delighted to help. Mohammed, I think you put what contact number or email is best. I'm sure Gareth will type that in there, and it will be on the presentation that we'll go through. We've got an anonymous attendee. Someone's being shy out there. Is there a disadvantage in terms of marketing one moves from CityDoc model to the MPA model? It's difficult to say. We, as part of our standard model, we do support with more marketing because at the end of the day there is a profit share and therefore CityDoc takes more money from that. It is more profitable to us to go around our standard model, and we provide the paid for searches such as Google AdWords as part of that. That's not just the marketing, because access to the standard model includes the PGDs, access to the patient record and diary system, access to all that expert health travel advice line, access to PSDs that Derek and our other clinicians are able to provide you. So it isn't as simple as just saying marketing versus a little bit different marketing. It's a very different model, and the reason we set it up with the MPA was to provide existing pharmacies that had a travel clinic a really simple way of getting more sales leads in. But we're more than happy to discuss that with yourselves. If you are an existing member and you want to change, then I'm sure we can have that discussion. Who else has got? Ashna, do we tell you which vaccines we can offer or services? For example, if we're not a yellow fever centre. Gareth, I know you're nodding. Do you want to take this one?
Yeah, of course. I was just typing a response to this. So you do tell us what you can offer in terms of services. So when we first set you up on the MPA model, we will take all of your competencies. If down the line you do become a yellow fever centre, you just need to let us know, and then we can activate those services as and when you're ready. Thank you.
That's great. Thank you for that. I'm just seeing if there are any other. I think I'm trying to answer some of these live, and Gareth is also is answering there. Derek, yes, you was it you trying to put a hand up?
Yes, just to follow on really from what Gareth was saying there about yellow fever. A lot of people get frightened becoming a yellow fever registration centre. I'm an RSC working with NAFNAC, and I am the liaison, the link between CityDoc and NAFNAC. It is my role to help you become a trained yellow fever centre if that is the service you wish to offer, and I will help you manage it, help you engage with that, and we will also help you with the annual reviews and supports. Because yellow fever is the only vaccine that is internationally regulated under the health under WHO IHRs from 2005. It needs a specialist management team, which is NAFNAC for this country, and then NAFNAC have attached to them RSCs, or registered supervised professionals, who will actually manage it. I am one of those. And if you do wish to become a yellow fever centre and develop your travel medicine, then we will happily support you through that.
Thank you, Derek. That's great to know. And I have to say, Derek, and dealing with NAFDAC on our behalf, it is a huge weight off my mind, certainly. And I know he provides excellent support to our pharmacists in the current network. I'm just seeing if there are any other questions that have come in.
Just to kind of add on to Derek there. So Derek really is a brilliant support to us in our standard operating model, which is available to anyone who doesn't currently have a travel clinic currently set up. The MPA side of this offering is more for those who currently have a travel clinic in place and therefore have access to all of the medical resources that they need, and therefore we generate you those bookings. But if anybody has any questions, I'm going to post my mobile number in the comments section, and you can give me a call sometime tomorrow or on my way drive home this evening, and I'll be happy to go through any of your other questions with you. Thank you.
Gareth's a brave man posting his mobile there for you all. Don't abuse it. Utam, I've just seen you've said, sorry, came on late, not a problem. Quick differences, MPA and direct model. We spent half an hour talking about the differences, and they will be. This is recorded and should be live on the MPA website tomorrow. But the quick difference is, if you're an existing pharmacist with an existing travel clinic, rather, this is a very quick way of getting more sales leads into your pharmacist. The standard model we have involves more compliance and access to Derek and our booking systems and so on and so forth. I'm just trying to keep up with the questions. Have I missed, Simon? Have I missed anything, do you think?
No, I think you can keep on top of that very, very well. Lots of questions firing in, so yeah. But no, that's fantastic. I think you've got to, I don't know if you give it a bit more time, just to have more questions, but I think, yeah, they've had a lot of come in. I mean, we're ahead of time. So if anybody has got any last questions to ping in now, otherwise, I think, yeah, if you agree, we can wrap the event up.
Don't be shy. I know some of you are down under there as anonymous, but look, Shin's had his details down on there. Gareth's put his mobile in there. You can definitely find us on the website, and this will be live sometime tomorrow on the MPA website. We also have our contact details, and there's a contact form on the CityDoc page of the MPA website. So, you know, please do get in touch. We're a pretty approachable bunch here, and we'd be delighted to work with you and work through any questions that you have as you hopefully look to grow your your travel health services, either from scratch or from your existing clinics that you have there. So, you know, we will be running other clinics, other webinars. We will be at the pharmacy show. More than happy to field any questions that may come in later.
Brilliant. Thank you, Jeremy. And yeah, thank you all very, very much for tonight's webinar. Just to mention again, yeah, the recording will be on from tomorrow morning, as Jeremy mentions, so you can watch it all or in part, and all the contact details will be there. And I think we'll be following up by email with everybody as well. So we will have all useful information sent over to your email, which should be tomorrow as well. But yeah, that just leaves me to thank you all very, very much for your time and all that interesting information. And yeah, we'll see you again soon.